Hi, how are you?
Good to see you. Hi Jude, you okay?
Yeah, are you, Tracy?
Yeah, I'm all right, thank you. You ready for today?
Yeah. This is it's exciting, isn't it?
Yeah, it is.
Yeah, very. Ooh. Here we are. Hello,
Hi.
everybody. Welcome.
Hi, Mandy.
Hi,
Great.
Harry.
Hi. So I think we're live, but let's proceed. Okay, so if you could all just go on mute during the call, unless I ask you to speak, that would be great because of the background noise. Thank you. Okay, so welcome everybody. My name is Harry Manda. Is everybody on mute? Please, thank you. Great. Hi, Anthony. So my name's Harry Manda. I'm the Strategic and Operations Advisor for the Nightingale Challenge. I am replacing Matt today. Now, let me just see if I can mute some difficulties with noise saving. So I'm replacing Matt today.
Sorry, I was just saying that could people mute their microphones if they're not speaking because there's a really loud noise? Is anyone hearing?
Yeah, hopefully that's the case now. I'm replacing Matt today, who unfortunately can't be with us, but he conducted a lot of work on this. So I'm happy to present, but I'm sad for Matt. So hopefully he will be able to watch this session afterwards and communicate with you all. So this session is about developing communities and networks and experiencing a pilot that Health Education England supported, looking at these communities. A big part of the Nightingale Challenge is trying to create this global community and trying to empower nurses. It's very important that we have this collective voice and a prominent voice in which we can share experiences and learn from each other in order that we can contribute to policy making.
Take their comments or ask questions.
So in the last 5 months, ending in March 2020, Health Education England and the Nightingale Challenge managed a pilot, and this pilot was based on a Facebook program that was set up by Jude Jones, and this was supporting 80 midwives. And what we wanted to do, or what Jed will talk to and Tracy will talk to, is that Health Education England adopted this successful model to try and see how this might work in order to communicate and share learnings and lessons among nurses, not just in a smaller community, but also globally in terms of expertise specific and also in terms of sharing general knowledge. What we're going to talk through today is the sort of the strategic need for this, which Jed will speak to as to why this was started, the operational management of this and how this was set up by Tracy, and then Jude, who was the original pioneer of the Face Mums project, will talk through her experiences of running this program and setting it up, and then we will talk to the experiences of some early pioneers in the pilot who were moderators and participants. And the whole objective of this session is to talk about why the virtual communities might be useful, how they might be useful, and lessons that we can learn going forward to make it useful. I'm going to start to share my screen now, and I think you should be able to see my presentation. So this is, I've just been through this, which is myself and Matt who have put this together. And then again, welcome to all the speakers, welcome to the participants. And we have some very esteemed professors and heads of nursing and PhDers, and welcome all and all participants. We'll go through the Health Education England Nightingale Challenge outline, the global selection by Tracy, face mask by Jude, and then our experiences and questions and answers. And if you do have any questions or queries, please do pop them in the chat box. And if we don't get them to them during the session, we'll respond to them afterwards. So with that, I'd like to hand over to Jed Byrne, Professor Jed Byrne, who is the Global Engagement Lead for Health Education England. Jed, would you like to talk a little bit about the strategic interest from Health Education England and why you initiated this with the Nightingale Challenge?
Thanks, Harry. Really appreciate it, and I'm really delighted to be here today. My name's Jed Byrne. I'm actually here under false pretenses, really, because I'm a surgeon by background, but I'm the director of global engagement at an organisation called Health Education England. And Health Education England, for those of you who don't know, is the organisation, the government organisation in England that is responsible for education, training, and the quality and quantity of the NHS workforce. And so we have an oversight of making sure the 1.4 million people who work for the National Health Service, the NHS in the UK, are of sufficient quality to deliver the highest possible care to our local population. I personally lead on a lot of the NHS's global interests, and was incredibly excited talking to Lord Crisp several years ago about the possibility of creating a movement amongst nurses at the inception of Nursing Now. And there's been a huge gap in terms of healthcare transformation across the globe, because the largest single workforce, nurses and midwives, have never been empowered in order to make the changes which they know should happen. And so the idea of creating a movement that would allow or empower nurses to do this was extremely exciting for those of us who'd been involved in healthcare system strengthening for many, many years. Then when, of course, the Nightingale 2020 challenge came about, there seemed like a window to move the movement of Nursing Now into something more practical. And the idea of identifying future leaders of nursing and empowering them from an early stage in their career seemed a very obvious way of creating sustainable transformation across the globe. The question, however, is, okay, so we identified these 20,000 plus individuals. So what? What are we going to do with them? How are we going to enable these nursing and midwifery staff to take responsibility for changing the face of global healthcare and delivering universal health coverage over the next 1, 2, 3, and 4 generations? Health Education England has multiple different arms, and we've become increasingly more interested in the development of communities for shared learning and shared support. And one of our programmes, Face Mums, has been hugely successful, led by Dr. Rose McCarthy and by Jude Jones, who's on the call at the moment. And following some conversations internally with our global team and externally with the Nightingale Challenge team, we arrived at the pilot, which is going to be described today. I'm extremely excited about it, and I'm really looking forward to hearing your views and your input over the next 50 minutes or so. Thank you.
Thank you, Jed. That's great. So now I'll go on to Tracy, if that's okay, and you can talk us through how you managed to initiate the pilot and your selection and recruitment of participants. Thank you.
Thank you, Harry, and thank you, Jed. Good morning or good afternoon, evening, wherever you are in the world. And this has been such an exciting opportunity to share our pilot with you over the next 50 minutes or so. So my name's Tracy Collins, and I'm the Head of Global Nursing, working with Jed and his team within Health Education England. And so last year we decided to undertake this pilot over 3 to 4 months, and to bring small groups of young nurses together to share learning and to talk with each other and bring their experiences together through moderated social media groups. And I, for one, sort of know as a nurse, we learn through talking with each other, sharing experiences, whether it's good or bad, even whether it's in a coffee room, just chatting with people sort of over lunch. We know that this is such an exciting opportunity, and this is where it works. And you build networks, you build long life friends, you're able to challenge each other. It empowers you to actually learn and go forward and share some of the learning in your clinical practice. So we decided to run this over 4 months, and we pulled together groups from the UK, from India, and 2 from Uganda, particularly as, within global engagement, we have a lot of networks and colleagues and do a lot of work in India and Uganda. So we sat and pulled together a steering group and, looked at the brief of how we're going to mobilise this pilot, being so diverse across the world. So the brief was to recruit 20 nurses in each group. So the four groups of 80 nurses in total, and all being under the age of 35 to meet the brief of the Nursing Now. And we wanted organisations to identify shining stars, so nurses within their clinical areas that we knew could be our future leaders. And so from there, we undertook a number of presentations around what we wanted to achieve, and Jude will talk you through shortly around the concept of the face mums and how that was translated into our social media pilot with nurses and midwives. And the presentations were undertaken with the chief nurse in Uganda, the late chief nurse of Uganda, and the Nursing Now lead for Uganda. And their task was to find 40 nurses for Uganda. So we had 2 groups, particularly in central Uganda and the rural areas. So there was that real diverse group of nurses within each group. And the same with India. And Elsa and her colleagues were tasked with finding young nurses in India to join the group. And UK, there was a number of NHS trusts or hospitals that are signed up to the Nursing Now campaign and the Nightingale Challenge. And again, it was talking through and presenting, this is what we wanted to achieve at the end of the pilot, and to test the concept of, can we undertake such learning and experience through social media such as Facebook? And so from there, the chief nurses and leads, they went off and identified their shining stars within their organisation, and 80 nurses were actually identified to join the groups. Now, alongside that, what was key are the moderators, and we wanted senior nurses with a shared experience to be able to moderate these groups. So particularly in their own time, so working full time and actually undertaking this moderated, experience alongside their full-time jobs. So there were senior nurses that came forward from Uganda and from India and from the UK, and particularly the overseas groups. We wanted to make sure that they were buddied with UK senior nurse moderators. So again, they can share learning from each other and have those conversations through social media of how did they want to stimulate discussion with the young nurses in the groups. And so I presented to Public Health England, to their technical advisors, which is a group of senior nurses, but they were very, very keen to be part of the moderated experience, and expressions of interest were put forward. And I know we've got a couple of our public health moderators on the call today, and they will share their experiences with you. So that is how we actually undertake the recruitment. And Matt and I, we had great fun over the following sort of few weeks, where we were able to try and pull all of these nurses together under the Facebook platform. So that took sort of a great deal of work, to create the groups, to bring the nurses into the groups, but also the moderators as well. Some of those nurses hadn't even used Facebook before, so that was a learning in itself. So there's been lots of exciting opportunities come from this going forward, and I know Jed, sort of towards the end of our call, will talk about next steps. But that's all from me on the recruitment and the initial stages of the operational mobilisation plan. And I know I think Jude is going to be the next lady on the call who will talk to you around the Face Mums concept.
Yes.
Thank you.
Thank you, Tracy. You made it all sound so simple when I can imagine it wasn't anything like that.
It wasn't in the beginning.
Okay, so now I'll pass on to Jude Jones, who was the Face Mums originator and a midwife and PhD student in Salford. Jude, would you like to talk through the next 2 slides about your experiences managing, setting up and moderating Face Mums?
Of course. Hi, I'm Jude Jones and I am the project midwife at Face Mums. A very brief gallop through what Face Mums is. Face Mums was created by Dr. Rose McCarthy. And what she was looking at was midwives being able to meet women where women are, which is on social media, and that looking at creating small communities of collaborative work together so that the midwives could work with the women and the women could work back with the midwives and learn together. This is an additional service to routine care offered in the NHS. It's currently being offered across it's 12 NHS trusts. I'm afraid I made a little mistake there. And we've looked after up to 600 mothers, and I've trained over 90 midwives in how to roll out Face Mums. Within the NHS, the service has been overwhelmingly positively received. With the latest survey results, over 84% of the women said that Face Mums improved their antenatal care. So what is Face Mums? It is basically small communities on Facebook of up to 20 pregnant women and 2 midwives from that NHS trust, so that they can share health information, answer questions and queries, but they are connecting the women together. And that's what I train the moderators in doing. They're creating what we call a social glue, where they're linking these women together and forming small groups. Moving on from this model, what we found was that it was so successful that it could be adaptable into any healthcare setting to create this form of social learning. And communities of practice is a social learning theory. It's about the teacher learning as much as the participant in that experience. So Rose asked me to join and to train the moderators and oversee the project, this pilot. So I trained the moderators either face-to-face or we used WhatsApp. We got quite innovative about how I trained the moderators in different countries. And then I created the Facebook groups, put the participants in and the moderators. And then I also created an additional group for the moderators, looking at communication and trying to enable moderators to communicate together. Communication is the key to all of this. Obviously, as been mentioned before, what we're looking is empowering young leaders of the future to develop their skills. And when we talk to people face to face, they're able to understand our tone, to get our jokes, to see the tears in people's eyes, and you can't do that on Facebook. So there is an absolute skill about using emojis or stories, ways of creating that tone and linking people together. We use intelligent kindness to support people and say, that's a brilliant idea, well done. And in the groups that it worked in within this pilot, what was clearly seen was the moderators were willing to share some of their experiences that maybe weren't wholly positive and look at how can we learn from this, how can we move on. And as we know in leadership, that is the way that positive leaders are made, is that they're willing to share their whole experience, not just the sort of positive glean that some people do. And then this adaptation has been seen not only in this pilot, but I've readapted it in COVID, creating information groups for maternity service users during COVID when the face-to-face care hasn't been there as much, and also using midwives that aren't able to provide clinical care, the shielding midwives have called them, and linking them together so that they can support their clinical colleagues that way. So this model is a very adaptable model. There is obviously quite a lot more to it, and if anyone wants to know a bit more about, I've put on Face Mum's details so that you can find out more about our model. Okay.
Great. Moving on to the next slide, Jude.
That is it. Basically, it's sorry, I didn't know how to turn the slide. So I've just rattled through it for you. But yeah, it was just how we supported everyone, was just connecting, and it's all about communication and using this as a different tool in communication. It's not going to replace face-to-face mentorship and support that way. It is just a tool that could be adapted and used.
Yeah, no, I like all the use, trying to sort of adopt your tone, and also intelligent kindness. That's all stuff that in these communities it's difficult to have when you're not face to face, which is something increasingly you're going to need to start making use of in light of COVID. So thank you, Jude. So now what we'll move on to is experiences from the first adopters within the pilot, of the moderators and the participants. So we have participants from India, Uganda, and the United Kingdom. So we have Ruth and Harriet, who were both student participants in the group, and a moderator, Theo Cavalisa. Apologies if I'm not saying that correctly. And then in the UK, we had Helens. So I think in terms of a discussion, it would be great to know if it was what people had expected when they joined the group, and then also what specifically they found useful. So if anybody would like to start, or perhaps I should pick somebody. I'm going to pick Elsa, actually, because she was the first one on the call. So Elsa, what did you find specifically useful, and also what might you have changed as a result of your learnings?
Thank you, Harimanda, for the opportunity. At the outset, greetings to all the nurses in this platform. And this is Dr. Elsa from Manipal, the Professor and Quality Management Representative from Manipal Academy of Higher Education. And also I coordinate the IELTS program here for the NSH UK, and also interact with a lot of nurses across the globe for the opportunities out there. So greetings to all of you from my team India. And at the outset, I thank Dr. Matt Daly, Dr. Jude, Dr. Tracy, Dr. Hannah, Dr. Craig Johnson, Dr. Jed, and I have been interacting with Hari Mandan since 2 days, and also on the Face Moms. There were a lot of experiences with the leadership in your team from Face Mom has really resonated as a leader, and we are very happy for that. And your leadership made us experience the live scenes that has happened among the midwives across the countries. It made unique experiences looking at life situations, which was quite mesmerizing. My nurses from India had a lot of expectations from this platform of learning. We had a lot of differences. Even inside Indian states, we have different practices. And when we had a discussion on life of laboring in the bathtub and things like that, which is usually is not seen in India, it was quite fascinating for my Indian nurses to know how various techniques are being used, labor support by the spouses, which are not existing in the real life scenarios in India. Because you all know very well that India, being a large country with various cultures and traditions, perinatal and postnatal practices are something very unique if you look at in India. Because history tells us already that in Indian family, we celebrate every part of process of a process a woman undergoes during her the entire pregnancy process and the delivery, starting from the baby shower, naming ceremony, first food that we give. And here in India, grandmoms play a very big role in taking care of the immediate newborn as well as the mother till the mother could take over. So diet, in particular, diet to Indian, if you look at South, East, West, and North, is completely different. So diet is very, very well chosen by by the the geographical differences, the caste, and also the creed, and there are so many factors into that which my Indian nurses, they themselves were getting orientated. And this was one experience, that a very positive experience with the nurses experience, as well as looking at the three countries practices. So my only one question arises from the thing is that, did this grandmom did really change their attitude? Yes, it did, because if you see, one of my experience which I said in the face mom was, a 7-day-old baby is also sometimes fed with mashed banana in some of the states. You can imagine very well it isn't right, because the baby's intestines are not well developed and they come with intestinal obstruction, and the baby sometimes undergoes laparotomy. But question here is whether these grandmoms really realize the impact of the the impact that they create on the newborn. So here comes the role of nurses in giving health education, which was very important for us. It took some 2-3 decades to change the mindset, but still it exists in some areas. So South, if we look at the experiences which we look at from my nurses from across the country, because I'm in the South and I know the very healthy practices that the mothers undergo postnatally, they get very beautiful complementary therapies, oil bath, hot bath, given by a trained, a woman in the village who are specialized for that and highly paid for. So in the third trimester, mothers go home to their mother's home, and then they deliver and stay back for a few months, relax, and then come back to their in-laws' place. But these opportunities are not shared in every state. And this is what my nurses saw from across the country itself. They have seen various practices. So my experiences were very unique with the nurses itself from across the country, because we face a lot of issues today. In this pandemic time, we have pregnancies have increased, abortions have increased, and there are not enough medical facilities available, and which the nurses really go through. These are the needs that my community nurses who were from the periphery, who were from the rural areas experience. And I think this needs immediate attention, because we need to address, because outcome of a mother and outcome of the child impact will have a lot of negative impact on the child and the mother, and hence this needs an immediate attention, which my nurses felt. And also the mentors have given us a real-time, mind-blowing experiences in sharing close-knit views on how birthing takes place in different countries. And it was quite amazing to us and something new to us. And if you see UK, the practices, the spouse are being there when they deliver. But in India, here it is not a reality. But we all know that psychological support matters a lot in labor. And I think this labor support has to be really enhanced and trained among the midwives, so that we are able to take. So team face moms moderators have given us stimulating experiences of sharing our opinions. They open up a new horizon in our outlook. Leaders in this project showed hope, compassion, and mindfulness in our dealings, because there were a lot of sensitive issues when it comes to dealing with the either the pregnancy or the postnatal practices. It is quite different. So this project helped us, think beyond the imaginary line, so as to how diligently a nurse midwife can play a critical role during this pandemic and the days to come. They face a lot of challenges during this end phase of the project. They face pandemic, and so the nurses had to disappear, get away from the group and go back to their work. And then they got engaged into the frontliners. So many of them in the front line. And these are some of the opportunities and also the challenges which my nurses have faced. So thank you very much for the opportunity to lead the team India, and it was amazing experiences. And thank you very much, Tracy Collins, for selecting me and looking at my leadership roles, which you have seen in the past 1 year. Thank you very much.
Thank you, Elsa, and I'm sure people will want to connect with you. And I think it's great to hear about the opportunities to share in a country that's so diverse culturally and practice-wise, that it's a huge job that you have moderating a group there. So perhaps if I could move on to another moderator, Theofisa Kabalisa, if you would like to just share a little about your experiences of being a moderator in the pilot, and what you particularly benefited from, and how you might potentially, change things in the future or be involved in the future. That'd be great to hear. Thank you.
Thank you very much. I greet you all. My name, as you've already heard, is Dr. Kabalisa. I'm a senior nursing officer Currently, I'm more in community training and training nurses and midwives about immunization and about surveillance. So I'm not really active in hospitals as such, but it was an opportunity which I welcomed very much. After all, it was just an added advantage because I was already training and mentoring the young nurses. Unfortunately, I started halfway when people had already started. So Jude helped me to go through to understand what I was supposed to do. So thanks, Jude, for the assistance. After starting, of course, I was connected to my group, that is group 2. Tracy was there for me, and we connected with the nurses. I didn't know the majority of the nurses. Most of them are from up country, a few from Kampala. So we started communicating. Through our communication and our discussion, through the topics we were sharing, unfortunately, not all of them could respond. But of course, I was understanding what was their challenge. Being up country in Uganda, we don't have continuous internet, leave alone that the nurses themselves have got to buy themselves the data to use. So I think that was their challenge, that they could not contribute much. But of course, I need to thank those who contributed every now and then, like my colleague Ruth, who is attending this meeting. She was always on the net. She was always giving suggestions. She was, sending challenges to all of us. So I thank her very much for her participation. Also, I need to thank the colleagues from UK who helped us. Also, I noted that before noting that, I found I did not know how to use a Facebook account for official issues. I only knew how to use it for my own friend chats and so forth. So thank you very much. That was a step ahead for me. I also learned that one. Later on, I tried to connect with my colleagues in group 2 if I could really find out what were their challenges, but it all was in vain. So I didn't pick up, I did not connect with them. Given that the time even was short, really, my experience is not all that much. But I have hopes that this can work with colleagues, especially in Uganda. Let me talk for Uganda, that it can work with colleagues who are within Kampala, where the network is available and not interrupted. But when it comes to colleagues who are up country, it's a real big challenge for them. So, but otherwise, it was a good pilot. It was, I really would have loved it to continue. And I don't know how we can help those who are up country to really, to participate. But from the little I have experienced, it's a very good innovation. Thank you for that innovative method of reaching and discussing with the colleagues, helping them to solve challenges, and also to mentor them to become good leaders. I think that is all I have to say for sure. Thank you.
Thank you, Vista. I think it was great to hear, and I think perhaps one of the lessons that I'm picking up is that Facebook is becoming something that can be much more useful in a different context as opposed to just friend groups, which hopefully maybe when Jed can talk to us a little at the end about what might be the future and how this might be able to continued, hopefully. But well done on using Facebook as well. I'm not very good at it, so you're welcome. So perhaps if we move now on to Helen as another moderator of the group, and then we'll move on to the participants, Ruth and Harriet, if that's okay. Helen, would you like to talk about your experiences making use of this pilot?
Oh, hi, Harry. It's Tracy. Helen's had problems actually connecting. She's just been sending me some messages. So
Okay.
her feedback is it was a really valuable experience, and it's definitely something that can be translated wider. I think what was difficult for Helen is, again, similar to Theopista, she joined the groups later on through the pilot. So of course those initial stages of bonding and engaging, which you get at the start of the groups, was a little bit more difficult. But one of the challenges, I suppose, for the moderators, which Jude alluded to earlier on, was around the Facebook and the internet connections. So the WhatsApp group, which was actually set up for the moderators to be able to communicate together sort of outside of the groups. So they were able to discuss, learning or scenarios, or just share even photographs or pictures to the group, so they could agree between themselves over WhatsApp to then post in the Facebook groups, which was proved really useful. But she's absolutely disappointed she can't connect to actually talk of her experience. But Helen works with Jed and I and the team in HEE, so I'm sure if anybody's got any questions, we can make sure Helen's included in that.
Yeah, we can reach. Thank you for that, Tracy. We can reach out afterwards to everyone who's been interested in this, and also we'll have the recording of this, which we'll share, and then also Helen's email address if that's acceptable to her. But yeah, maybe this is one of the things that we can start advocating for, that we get this internet connection globally. If we can't connect face to face, then we need to have that as something which clinicians like the nursing staff need. But yeah, these are all good points for how we can start directing our focus in the future for the Nightingale Challenge.
Absolutely, and I think even now during COVID, it's such an opportunity where groups can come together and just to talk through their experiences and difficulties and emotions, which is all very important in our learning, sort of as a person, as well as professionally.
Yeah, definitely. So now we'll hear from the other side, from Ruth and Harriet, who were participants. So perhaps if I could start with you, Ruth Nakabuga, about your experiences of being a participant in the pilot, and what you particularly enjoyed or what you might have changed, and it'd be great to hear from you. Thank you, Ruth.
Thank you, Harry. Yeah, I'm grateful to be here on this platform and attending this event. My name is Ruth Nakabuga, like you already known. I registered in Mengo Hospital, one of the first hospital. It's actually the first hospital in Uganda, and I'm grateful to be working there. I work as an in charge of one of the departments. That's I department. Yeah, that's where I am located apparently. And I'm sure some of them have registered in to listen to this. I want to share about my experience about the Nightingale Challenge, the group. The first time I heard about it, actually, I did not know that we're going to use social media, because like Topist has said, with social media, always it's usually something that we're using for just catching up and not about official things. And so at first my expectation was, when I first heard of the group, I thought we were going to have an app that was going to be downloaded, an app that was going to be used as our studying thing. Yeah, but I'm grateful that you people initiated the Facebook, and it became a challenge, and amongst the groups that were able to share with one another different ideas. And I would like to share one of the biggest idea that came up during the discussions. It was about leadership and our experiences at work involving leadership skills. And that one ran, and we discussed that for a very long time. We really discussed that for a very long time, and we got so engaged, the few of us. Yeah. So the few of us who are involved in the discussion, at least as I remember, because the challenges I cannot repeat them, they have been already mentioned. But the few of us, we got so much engaged, and we came up with different points that were challenged to go back to our stations or different workstations, and be able to engage with the rest of the nurses there. But this platform has given us capacity building. It's a way of building capacity. And for me, I acknowledged so much where our moderators, even us ourselves, acknowledging the fact that we need to build on our knowledge, we need to go back and add on our career and build our career. So it's a way of building capacity. And then it builds confidence. I was able to be confident enough to walk to my supervisor after one of our moderators shared one of the tools of supervision. So I had a lot of questions that I had to put place to my supervisor. How are we really going to work out this so that it works also in our hospitals in Uganda, most especially where I work? So I put it forward, and it's something that they're looking upon. We were challenged to be initiative and innovative when Helen shared the plantation in Gulu that she put up. It actually talked a lot about us. We need to be creative as nurses. We need to think about out of the box. Something that I went back and sat and thought about it. What more can I do beyond what I'm doing right now? Yeah, so it's a question that I need to answer myself, and I need to see myself doing something more. Yeah, and then we're challenged to have a vision. It's on this platform we're challenged because out of the discussion as we spoke, we're challenged to have a vision, because you cannot be working every day, but you do not have a purpose, you don't have a plan, you don't know where you're going. Yeah, so we're challenged, and that was my key points that I picked out of the challenge. And then having the right attitude while we are working, because as ourselves, if we do not lead ourselves, then no one will. If we do not motivate ourselves, like I attended one of the sessions earlier where they talked about motivation, and I remembered we also discussed it in the group. So if we are not able to motivate ourselves and we wait for others to motivate us, then things can go wrong. We need to motivate ourselves first, and then we can be able to, then others can come in actually to motivate us as we are also motivating ourselves. And the challenges have been actually talked about. I do not want to repeat them because they are the same challenges. But the group, I gained a lot out of it. And when Matt sent me an invitation and talked about it, I told him I'm ready to share, because I'd already shared some of the things with my supervisor and the immediate people that are the team, because I had to start training. I want to thank you very much, because this is a mentorship program, I believe, that where we are given a platform of us, amongst us, that we need to mentor ourselves before we wait for others to mentor us. That's the only way we can also be able to mentor others. I thank very much the moderators. They were so good. I thank Kerry. I thank Helen, and I thank Topista, although she came in later, but she was so supportive in the discussions that we initiated, and I have gotten a lot out of it. Thank you, everyone.
You're welcome, Ruth. Thank you. And again, this whole presentation will be available for more people by recording. So what I'd like to move on to next is Harriet. And then if it's okay with you, Jed, I know this is a bit of a surprise, but if it's okay with you about like the future, next steps, because I think you're better at that kind of visionary stuff than I am. Perhaps Harriet, I think we've got 5 minutes. If you could have like 2 minutes perhaps on your experiences, or 3 minutes, and then we can move to Jed, that would be great. So yeah, last but not least, Harriet, who's exceptional. I think you set up and directed the Milcott study, which I'm sure we'll come up to in another session. Yeah, please do continue, Harriet. Thank you. I think you're on mute. Yeah, that's good. It's good because then I asked you to. Still can't hear you. Anthony, is everything all right? Can you hear Harriet?
I can't hear Harriet either, I'm afraid.
Oh, Harriet, are you definitely on? You're off mute?
Yeah, it doesn't look like she's on mute on the program.
Maybe she's refreshing.
Yeah.
No. I can see your lips moving, but I can't hear you.
If possible, it might be best to log off and then log back on quickly.
For Harriet or for myself?
For Harriet. Yeah.
Harriet, do you want to briefly log off and log on, and then we'll let you have the last session, and we'll let Jed speak now while you log on and off? So Harriet, if you log off and log on, and we'll move over to Jed now. While you're logging off and on, we'll let you have the last word. So yeah, if that's okay, Jed, would you like to talk about like the future, the next steps, and what you see as the potential for this? Please, thank you. Are you on mute? Anthony, is there something I'm doing?
I can't hear Jed either. I can hear you fine. Can other people hear Jed or Harriet, or is it just us? No, you can't either.
You can hear Harry, can hear Jed, but can't hear Harriet.
Oh, you can hear Jed?
Yes.
Oh, then it's only me. So Jed,
I can't hear Jed.
No, I can't either. Yeah.
Jed, you may need to refresh and Anthony, is it a hard stop at 11:50, or does it?
Well, no, because we've got lunch after this, so it can.
Okay,
it's an hour lunch, so we can feasibly continue.
Great, so we can carry on for another 10 minutes.
Yeah.
Thanks. Jed, can you try speaking again? No, can't hear you. You might need to log off and log on again, or refresh. Apologies, everybody. It's the first virtual conference for the Nightingale Challenge. Everybody's learning.
Hello, can you hear me?
Yes.
I can hear you now, Jed. Yeah.
Harry, can you hear me?
Yay! Yes.
All right. Okay. So it was probably not worthwhile hearing me, as I was only ruminating anyway about what had been said. But I'm really very grateful for the opportunity just to share some thoughts about this. I suppose you could imagine a world where 20,000, maybe 30,000 nurses were all interrelated, irrespective of the environments that they were delivering care, where they were able to pose questions, take guidance from senior leadership, and allow the development of a relationship in focusing on delivery of the highest possible care to their local populations by using the support and shared knowledge of those nurses in similar developing leadership places across the globe. I think that would be incredibly exciting. COVID-19 has taught us that more and more and more, our responses to global healthcare challenges need to be met with a global response. And I do wonder if 20,000 senior nurse leaders in 20 years' time, who are all talking to each other regularly, were faced with a new outbreak of COVID-19, where the impact of COVID-19 would have been quite as bad as it has been over the course of the last three months. With that in mind, I think anything or any innovation that draws people to start to communicate and develop friendships, intelligent relationships, share knowledge, offer relational continuity in terms of mentorship, and take advice and have access to those very senior nurses who've seen it and done it in previous generations is something that we ought to pursue. I am overwhelmed that the transfer of something which is successful in a very closed environment like the UK in FaceMums, that the team has managed to overcome the obstacles faced by different quality of IT infrastructure across the globe to get this pilot up and running. Health Education England themselves are very, very keen on expanding this pilot. We ideally would like to offer it to all potential young leaders and to all experienced nurses to participate in this development of multiple small communities of practice and one huge global nursing community of practice. We are going to take away the results of this pilot, and I promise you that we're going to expand it and enhance it for the next phase. So I'm extremely grateful, really, for your participation and for what we have learned. And I feel very, very confident that this is a small pilot on which great things will be built. So thank you very much.
Brilliant. Thank you, Jed. That's really exciting. Hopefully, yeah, this will be expanded, and we'll look forward to hearing more from you. So I think the last word was going to be for Harriet, and if she's not able to connect, then that's a real shame, but maybe we can find some way to communicate what she would have said otherwise. So it just goes to me to say thank you so much to such eloquent and experienced speakers. And I apologize if I didn't get your titles, because every single one of you is a professor or a director or a lead in something. And I couldn't get my notes up with the presentation at the same time. But I really appreciate everything you've said. And I look forward to sharing more of this and connecting with you all afterwards. Mm-hmm. Oh, hi.
Yes, can you hear me now?
Yes, please do. You have the opportunity to talk of your experiences, and you can close the session for us. Thank you, Harriet.
Oh, great. Thank you very much, Harry. And I'm really sorry for the disturbance with the computer. And it's been indeed my pleasure to hear the experiences from Uganda, Theopista, and Nakabugo. Well, I would love to share my experience in the group where I was. And at the beginning of the group, of the program, everyone seemed to be highly expectant. However, there was no definite direction. And there I called for a structural framework for this program, because when I saw the mentor coming in, and the mentor really has a high profile and she would be really helpful, but it's sad that we did not utilize that opportunity. But if
the program is really structured. For example, me who has an experience in mentorship, in formal mentorship, I would love that formal mentorship be introduced. For example, nurses and midwives need to be choosing their mentors. If mentors are brought to their vicinity with their profiles, I would think this is very, very important. A nurse or midwife can closely monitor what the person is doing and to see what she can benefit from that person. And then it takes creation of relationships that can favor this mentorship period. So mentors, because we have really amazing and great nurse leaders in the country, but if they are brought in a way which is formal, so every nurse and midwife can be able to walk away with a mentor and then let this relationship be supported outside the Facebook group, because we have different interests. That's another challenge that I realized. We have different interests. For example, I might be interested in leadership, another one in advocacy. But if we are brought together, it's hard to determine the direction where everyone is going. So we get lost on the way. I didn't see many of the members participate. I used to see the moderator bringing in dropping in the information, but then for us, we could not participate well. Probably there were some reasons. One, we have the challenge of internet, but there is also this reason that if someone doesn't feel maybe safe, safe in a group, she doesn't know how far the information will go, and they need to also be supported on use of Facebook, because as Nakabugo said, many of us are used to Facebook as a social platform. You just throw something that you want to go viral. But now in this context, which is formal, they need more information and skills on how to use it properly. Yes. Another thing is that since it needs to be formal, that means also the mentors themselves need to be trained with the skills of mentorship outside the group. I'm sure this can be done, as mentorship is being mistaken with coaching. Yes, mentorship takes more of developing someone, allowing her grow, but here it was more of coaching, I think, because it doesn't help a nurse or midwife to realize the needs, the things that she needs from a mentor. We need close relationship. That means you help her, you help and support us outside the group. And then also one mentor supporting a group. I'm not so sure how this can work, because me, my experience is on one-on-one formal mentorship. There I can be really open to her. She can be open to me, but here it's a group. It is a group. And if it stands without an outside relationship, it might not be open because someone else is seeing your relationship. Yes. So that one is a little bit lacking. It's good that this session is intentioned to bring in ideas that can help step it up. Yes. So also setting the goals clear and let these goals be brought to the learners early enough. Let the goals of the group be set earlier, and let the nurses and midwives have them earlier before opening of the group, so that someone can decide whether she will join or not join. For example, me, I was in the group, but I didn't know my fellow members. What do they have? Am I fit to be in this group? Is it taking me ahead, or it's leaving me at the same level? I need to see the goals, and I need to see the team whom I'm with, because I might be at a higher level, or they might be at a higher level, but I do not understand what to benefit from. So this should be discussed before and then brought to us, to the nurses and midwives, just before it starts. I think those are the points that I was able to put across. But this is a very good initiative. I think it just needs to be structured properly. It just needs to be structured properly.
That was great, Harriet. I think it was so good that you could reconnect, because all of those points were so valuable, and just the great information about the intimacy in the groups and like being able to choose your mentors and knowing what the levels are of the groups is brilliant. Thank you. And yeah, I'm sure Jed, Jude and Tracy, and hopefully with Nightingale Challenge support, we can help facilitate, fingers crossed, the next phase. So once again, thank you all very much for your time, and enjoy any other sessions that you might want to participate in. And thanks again, everybody. Bye-bye.
Bye-bye. Thank you.
Thank you. Bye-bye.
Thank you.
Thank you.
Thank you.